All right, well, here I am with Dr. Michelle Jorgensen, holistic dentist, and we're talking all about the mouth, gut, body connection, what's happening in your mouth, whether there's infections, toxins, and different issues taking place in your mouth, how that affects your gut and how that affects your overall inflammatory process and really everything in your body. And she's got a great story. And I just finished reading her best-selling book, Living Well with Dr. Michelle. Great book to check out. And so, Dr. Michelle, welcome to the podcast. And let's start with what happened that nearly made you leave dentistry.
Yes. Well, thank you so much for having me. I'm excited to share today. You know, I am a dentist. Was born into a dental family, I like to say. My dad's a dentist. I have 3 younger brothers, 2 are orthodontists, one's an oral surgeon. So this is just kind of what we do. And I thought that is what I would do. Just like my dad, he's still practicing in his mid-70s. But that's not how it went for me. I was doing great dentistry. Our practice was growing. Everything was great, but I wasn't great. My health really started just taking a downturn. And, you know, anytime you start having health issues, you start looking at every source possible, right? And that's what I did. And my first main symptom was gut issues. I got to the point that I couldn't even drink water without pain. So something was really wrong. Started going to doctor after doctor, no answers, just here's a little pill, take this, it's going to help for sure. It didn't help. So we threw away all of our food, we changed the way we were eating entirely, and it helped some, but not all the way. And the other big issues is my memory. I've always had a good memory, and I couldn't remember patients' names from room to room. I couldn't complete sentences. I mean, it was very, very noticeably different. And then numbness. I had painful just pins and needles numbness all the way down my hands, my arms. I couldn't sleep at night. I'd sit on the edge of the bed just shaking my hands, trying to get them to wake up all night long. I couldn't brush my teeth. I couldn't blow dry my hair. You know, anything that was above my arms or above my shoulders at all. And I stopped being able to hold my dental instruments. So at this point, what do you do? You know, I had 4 at the time, 4 young kids at home. My husband worked for the practice as well. This was our entire livelihood, but I couldn't do it anymore. So we put the practice for sale. And I had learned a lot about nutrition and trying to fix my own. And so I thought, well, maybe I'll be a nutritionist and I'll work in a dental practice and do that. And it was kind of a new thing at the time. And so I reached out to a dentist that had a nutritionist in his practice. And he said, before you go any further, your symptoms sound a lot like mine. Have you ever looked into mercury poisoning as a possibility? And that was the first time anyone had ever said those words to me. And I said, well, no, I don't have any fillings, because I knew that silver fillings had mercury in them. We'd been taught that in dental school. But I said, well, no, I don't have any fillings. And he said, it's not the ones you have. It's the ones you've been drilling out for the last decade with no protection. Again, first time I'd ever been told that. Really, the only thing we'd been taught in school was that if I told somebody mercury could affect their health, I would lose my license. So that's it. That's all I knew. But he said, well, isn't it worth getting tested? Well, of course it is. So got tested, and that's what it was. Mercury toxicity off the charts. Had never heard of this before, never knew it could be a problem, but mercury is a neurotoxin. So all of a sudden, my hands, my numbness, my brain, my gut, everything made sense. So when we found the answer, the doctors all said, well, you can't keep putting it in if you're going to get it out. So you have to figure out, is there a way to keep doing your job without breathing all of this in? I found there was an organization that already had protocol for this. I'd never even heard of them before. And I just had to go on this journey of finding, well, what else is there that I didn't even know about? And it really shook me, because I thought, this nearly took my entire career, my health, everything else, and no one is talking about it. And it just really made me think, what else inside of dentistry is no one talking about that could be incredibly impactful on health? So I changed my practice, the way I was doing things for my own purposes. But then patients, obviously, when your dentist walks in like this hazmat suit to take out your filling, they're like, oh, what's going on around this place? And, I would explain, well, this is for my health. But usually they would say, well, isn't this probably better for me too? Yes, in fact, it is. And then they started asking other questions that I didn't have answers for either. Things like, well, how about fluoride? Like, I've heard maybe it's not as good as you guys talk about. And what about root canals? And I was still doing root canals. I was still prescribing fluoride, all of these things. I had to really just dig into the research and find out what is really true, not just what is our standard pat answers that we've been taught to say as a dentist. And it has entirely changed the way I practice and the way I look at the mouth as a source of potential health concern and how it impacts the rest of us. So my practice now, people fly from around the world to come and see us. We have a multi-specialty team. We have a campus. Not what I would have envisioned at all. But I simply can't see the mouth in the same way anymore.
Yeah, it's so critical. And, that's always one of the things when I was seeing patients, when they weren't getting better, when we changed their diet, got them on some good supplements, right? Changed their lifestyle, got them sleeping well, things like that. And they weren't getting better. I always thought, okay, maybe mold, maybe some sort of oral infection. Of course, if they had amalgams, we already talked about that. But sometimes there's these hidden oral infections. Maybe they had root canals, wisdom teeth taken out, things like that. And the mouth just plays such a critical role. If there's hidden infections in there, that's going to just drive inflammation throughout the entire body. And most people are just not aware of that. So you mentioned some things. You mentioned fluoride. You mentioned root canals. We've got to go into those. So let's talk about fluoride. Let's talk about root canals.
Okay, let's do it. Well, the interesting thing about fluoride is, I joked that I was bathed in fluoride, and we all actually probably were bathed in fluoride because it was in our water. But I was given so much fluoride growing up because my dad was a dentist, so the fluoride was the thing. It was the thing that made us, cavity proof, armor proof, armor on our teeth. I had so much fluoride growing up, and in dentistry, that's just what we are taught. Fluoride is the answer. If people don't use fluoride, they're going to get cavities. So early on in practice, I was researching all of the water fluoridation levels in my area and sending this all to pediatricians and telling them to prescribe fluoride. I mean, I was all in. I'm talking, completely. I was the advocate that was pushing this to all the doctors, everything else. And when I started researching it, a couple of things popped up right off the bat. Number one, cavities are not a deficiency of fluoride. So I want people to understand this. Cavities aren't a deficiency of fluoride. So if it's okay, let's just talk about what causes a cavity. People think I eat sugar, I get a cavity, right? Well, it's not exactly that. It is in a way, but it's not exactly that. What happens is our teeth, the teeth that you're looking at when you smile, they're made of a mineral called hydroxyapatite. So it's a mineral complex, calcium, phosphates, all kind of grouped together in this mineral. When acid sits on the tooth, it dissolves or pulls that hydroxyapatite or those minerals out of the tooth. It's really basic. It's just like any acid. People used to do this trick where they'd pour Coke over the battery terminals in their car, and it just like eats away the acid. Or if you throw like a quarter in a cup of Coke, it just like eats all the crud off of it. Like that's what acid does. It eats away minerals. That's just what it does. So if you put acid on your teeth, it's going to eat a hole in your tooth, in essence. So where does the acid come from? Well, one of the sources might be your diet. This is why we tell people you really shouldn't be sipping on Coke or energy drinks or even some of these pre-workouts and electrolytes and things that everybody are using because they're acidic. You need to look at the acidity of what you're putting in your mouth. Can you never drink it? No, go ahead and drink it, but get it down the hatch and get it gone. It's the constant exposure on the tooth that leads to the problem. So it's acid from your diet. It's also acid just from your mouth. The digestive process itself, the first step is the mouth becomes a little more acidic. It starts to digest our food. It's just part of what we do. It's part of what we're supposed to do. It was supposed to happen. So that's also a source of acid. The third source of acid is, now it's what your mom always told you, eat more sugar. The bacteria in your mouth then eat that sugar and they excrete acid. So it's not exactly sugar causes a cavity. It's sugar feeds the bacteria. They excrete acid. So it's all about acid, right?
So the acid is the postbiotic. It's the product that's being produced. Is that primarily lactic acid? What kind of acid in particular are they producing? Or different types of acids?
That's a great question that no one has ever asked before. Now I have to go find the answer.
I'm a chemistry guy. Biochemistry is interesting to me. So.
I think it actually probably is lactic acid.
Right.
Very good. I love that. So some sort of acid that will be in the future disclosed to us. Lots of acid sitting on the teeth, and it just simply pulls the minerals out of that enamel matrix and leaves a hole behind. So what does fluoride do? The idea of fluoride is awesome. It was introduced in the 1930s. What they found is there were these populations of people who had stronger teeth. They were more cavity resistant. And they studied and they found they were people drinking well water that had higher levels of fluoride in it. So this concept was great. Oh my gosh, we can prevent a cavity. We can make teeth stronger. This is awesome. Science has since found out that fluoride changes the chemical structure of the tooth. This part I do know the answer to. So it changes that actual chemical structure. It changes hydroxyapatite into fluorapatite. It kicks the calcium out and substitutes the fluoride in. Fluorapatite doesn't dissolve in acid as easily. Awesome, right? I mean, these things are awesome. Makes the tooth stronger. It doesn't dissolve as easily. So again, it doesn't replace or fix a tooth. It changes a tooth, chemically changes a tooth. Idea is awesome. The problem is, and you know this so well, anything we put in our body doesn't just change one cell or one type of cell. It's going to affect every cell. And in the modern medical world, we call this a side effect, right? But people don't understand. A side effect is simply the effect that something has on another cell in the body. Some effect we like we wanted to change our teeth. We want them to become more acid resistant. Awesome. But it's also going to change other cells. It's also going to affect them. And we can't do anything about that, right? We can't just say, you just go here and you don't go here. It doesn't work that way. So what other cells does it affect? Well, first of all, our bones are made up of 70% hydroxyapatite, same mineral. So if fluoride changes teeth into fluorapatite, guess what it does to bones? It changes it into fluorapatite as well. It changes literally the structure of our bones. It makes them more brittle. So in a tooth, it's okay because we have a spongy, softer collagen layer underneath called dentin. So that brittleness, it actually is okay. In a bone, it's not okay to have a more brittle bone. And so research shows in areas of high fluoridation, you have more bone fractures. So already it's changing density in bones. So that's not a great thing. Number two, it actually affects the thyroid in an interesting way. Thyroid hormone, as you know very well, is activated by iodine. Iodine and fluoride are cousins. If you look on the periodic table, you're a chemist, you know this very well. They're halides, right? They're fluoride, iodine, bromine, chlorine. They're all cousins. So that means they're very close in structure. They look alike. Well, now fluoride can bind in the same place iodine should in your thyroid hormone. So you have bound hormone, which should make it active, but we can't use hormone bound by fluoride. So you even make it lab tests that say you have plenty of thyroid hormone, you're doing just fine, but it's not usable by your body. So here's the crazy thing. In the 1950s, this was actually a known treatment for hyperthyroidism. If your thyroid was overactive, they gave you fluoride to slow it down. So how many people in your world have thyroid issues?
I mean, every middle-aged woman, basically.
Me, I'm your demographic, right?
Oh yeah, absolutely.
Exactly, me, every single person just like me. Well, how many of us were literally bathed in fluoride? And fluoride is everywhere. Fluoride's in our water supply. So that means even if you get some sort of a canned drink or a canned soup or something, it most likely was made in a plant that also had fluoridated water. So we don't understand. It's not just the water we're drinking from our sink, because we might put a filter on that. You have to have an RO filter to actually get fluoride out of it. You have to have something very, very strong to be able to do that. But we are getting it in processed foods and packaged, processed drinks. We're also getting it in so many other different ways through all of the toothpastes, mouthwashes, like everything you're getting at the dentist. They're putting fluoride treatments, and a lot of the dental materials themselves have fluoride in them. So there's so much fluoride. So it's literally making our thyroids not work properly. All right, strike two for me. Strike three came last year, January. This came a little earlier, but this one was solidified by research. New research study, January 2025, showing higher fluoride levels, even in the mothers, led to lower IQ levels in children, especially male children. Literally cause and effect. You increase fluoride, you decrease IQ. So strike three for me, right? And here's the thing. Cavities aren't a deficiency of fluoride. So if we didn't have an option, if it was we're all going to lose every single tooth in our head unless we do this, then maybe we could say, I guess it's worth our bones breaking and our thyroids going kaput and our IQ dropping. Maybe if that were the case, but that's not the case. We have an option now, and it is, guess what? Hydroxyapatite, the exact thing our teeth are made of. Acid pulls it out. We can put it back. Isn't that amazing? This is really, to me, the biggest advancement in dentistry probably in this century is that we now can put back what our teeth lose in this decay process. We can put it right back again. And that's absolutely incredible. So we do not need to use fluoride ever again. Research shows hydroxyapatite is as or more effective than fluoride at preventing cavities. Not only that, it actually can heal a cavity. Fluoride can't heal a cavity. Remember, we said it just changed the surface of the tooth. Hydroxyapatite can fill in the hole that was left behind. So it can actually heal a small cavity and reverse it. This is amazing.
Wow. Yeah, I didn't even realize that it could heal the cavity. So with dental treatment, you can actually put in, so obviously somebody could be using hydroxyapatite-based toothpaste, fluoride-free toothpaste at home and using that regularly. But I would imagine to heal the cavity, it's got to be a little bit more specific. Is there something else that you're doing, like when somebody comes into your office as a dentist with using the hydroxyapatite? Like, is there a specific treatment for the tooth, or are they able to work on this at home?
You can actually work on it at home. Frequency is more important than dosage. So when you're going to the dentist's office, you're getting a high dosage of something. So we actually do use something called a hydroxyapatite varnish when you come into the dental office. So we're going to put a high percentage of something on your tooth, but it's going to erode away. You know, your next 5 meals and your acid attack are going to take it away. But that's actually something really cool about hydroxyapatite as well, is even if it fills up holes in the tooth, but it also creates kind of an armor coating on the tooth. So then when you get your next acid attack, it's going to erode away that armor coating you put on the outside before it even touches your tooth. So frequency is the most important thing. You just need it every single time you're going to have, something put in your mouth. So every single time you're going to brush your teeth, you're going to use something with hydroxyapatite in it. This is so crucial. You have to have hydroxyapatite in your tooth care product. So you said you loved the tooth powder. I'm so excited about that. And so many people, millions, literally, you've sold millions of jars of this. So many people love the tooth powder because it feels like you did something, doesn't it?
Oh, yeah.
Like when
it's got like those essential oils in there, like the minerals, and it lasts longer than your typical like toothpaste you're pushing out of, a plastic, talking about other toxins, right? A plastic bottle, like basically you just get a little bit of water and you dip it in this powder, and a little goes a long way. And you've got essential oils in there. So it's like you can feel it right away.
Yep.
In your mouth.
And you feel it on your teeth. Like people often say, they're like, I feel like I just went to the dentist. Like every time I clean my teeth, I feel like I went to the dentist because it actually cleans and then it fills up the holes. That's what it's doing. It's filling in all those defects. So if you do that every single day, we also have a mouthwash you can follow it up with if people want a mouthwash that also has hydroxyapatite in it. We have mints you can pop during the day. It's about frequency. The more often you add hydroxyapatite to the tooth, the more holes you're going to fill in. So if you have a deep cavity, if it's getting close to the nerve, if it's deep into the tooth, you're not going to heal it by just brushing your teeth. And I really want to make that clear.
Yeah.
Even going to the dentist, we're not going to be able to put a high concentration of hydroxyapatite. It's not growing back a tooth. If you have a chunk missing, you're not going to rebuild it this way. That's not how this goes. You're going to go to the dentist, they're going to fix the tooth, and then you're going to use hydroxyapatite and never get another cavity again. That's the key here. But if you have a small cavity that's just in the outside surface of the tooth, in the enamel, that is a mineral loss hole. This absolutely will fill it right back in, and you will be able to have a tooth that you don't have to get fixed at the dentist. The key is, how deep is it? If it's deep into the inside layer of the tooth, it's not getting fixed with this. If it's in the outside layer, absolutely. So really, every single day we lose minerals and we should be adding minerals back. This is an ongoing process all day long. Every single time we eat, we lose minerals. Every single time we brush, we should be adding them back. This is just this ongoing process. You do this, you don't get cavities. We find
and you said something really important there that most people are not aware of. There is a difference in types of cavities. Most people just hear you have a cavity and they think it's all the same. They think, okay, well, I have to have a filling. I have a cavity. And this just recently happened to me. Like I've never had a cavity. And then I just recently changed dentists because my holistic dentist, he's like an hour away. He's somebody I know very well. I've gone to him regularly, but like my teeth, he always says my teeth are great. So I went to a local person. They did, I hadn't had x-rays in like 10 years. So they did x-rays and all that kind of stuff. They looked at it and they're like, oh yeah, you have like 3 cavities right back here on your back left side. And I'm like, all right, whatever. They're like, you need to get these, done right away. And I'm like, no, what are other options you have? And they had a laser treatment. So I was like, oh, I'll get that. That's fine. I'll get the laser. And I got that. And then Bond Charge, one of my sponsors, they sent me a red light toothbrush. Okay. And I was already using, this is before I got your powder, but I started using it. The toothpaste I have is natural toothpaste, fluoride free. It's got clay in it, hydroxyapatite. Brushing with that red light toothbrush and just really spending more time back there. And then I went back in for a dental cleaning, and the hygienist was like, wow, your teeth are a lot better than last time. I was just looking at this, like, they're a lot better. So I'm excited now. I've been using the remineralizing tooth powder along with the red light toothbrush. So I'm excited to see where I can take my teeth here.
Yep. Very good.
But you don't always like all that to say that, like, I knew that even if I did have a cavity, I knew like I had zero symptoms. I just didn't feel like, I just trusted my intuition. Like, I don't need to get this filled. Like, I'm just going to try to take care of this at home. And if I did have worsening symptoms, then I would obviously consider doing something. Right. Yes. But that's what most people are not aware of. They just hear cavity. Okay, we need to drill it out. We need to fill it, whatever it is.
And there's really another piece that I want to make sure people understand too. There's another way to put minerals back into your teeth. So hydroxyapatite on the outside is really important. But here's a fascinating thing. And again, there's certain demographics that are going to relate to this one. In fact, in church on Sunday, just this last week, a lady in front of me turned around and she said, my son, he's 17 years old. He was just told he has 16 cavities. And she was just devastated, right? Her husband's a school teacher. She's like, I don't know how we're going to pay for this. Like, I don't even know what we're going to do right now. How can I, what can I do about this? So there's certain demographics that this shows up in. 17-year-old boys. Oh yeah. Cavities like crazy oftentimes. Pregnant women, nursing women, menopausal women, or even men that are on things like high blood pressure medication and they have a dry mouth. So what's changing in those populations? And it's interesting. Some of this research was presented in the 1940s. It was a Dr. Melvin Page that talked about it. But it took me a while to figure out the reason behind this change. If you think about the body, it has a limited reserve of things. It only has as much as we give it of certain things, right? It can't just create a mineral out of nothing. So the minerals that our bodies have, we've given them. And that's all it has, is what we've given it. That's it. Mm-hmm. There's no more to be had. So during those times, teenage years, pregnancy, nursing, menopause, there's a high demand for minerals in the body. So teenage years, pregnancy, you're literally growing a human. So think about bone growth. And just on a regular maintenance basis, our brains, our hearts, they use minerals too. If you've not given your body enough minerals to do all of those jobs, it actually has to prioritize. And guess what's the bottom of the barrel? Your teeth. Because we can live without them. Like, you can lose every single tooth in your mouth and you can still stay alive. Believe me, there are people alive today with no teeth in their mouth. So you can live without them. Your body knows this. It will prioritize. So it will literally, there's a fluid flow inside of the tooth. Usually it flows from the inside out, kind of redosing the tooth with minerals from the inside. But if there's no minerals to be had, the fluid flow reverses from the outside in. And you will pull minerals from your teeth to take care of the other needs that are more important and pressing in the body, like growing the bone. So this is the 17-year-old boy with 16 cavities. Basically, his body, and his mom said, she said, he's grown more this year than he ever has grown. This kid's like 6'2", and so he had to grow those 6'2" bones. The minerals had to come from somewhere. And she said, yeah, he's been eating terrible this year. He won't eat the food I eat, I make. He's fast food all the time. So he just was in a mineral deficit, and the body took them from where they could find them. So showed up with cavities. There's times in our lives that this happens. So what do we need to do? We actually need to feed our body enough minerals. And I'm sure you know only too well, the minerals are only effective if you pair them with vitamin D3 and vitamin K2. So this is what we call our remineralization supplements as well. So if you have a cavity, if you have 3 cavities, if you have, something going on, I'm going to tell you, you're going to put minerals from the outside, which is hydroxyapatite tooth care product. You're going to put minerals from the inside, which is specific. We have what's called our tooth and bone formula, but it's specific minerals for teeth and bones and vitamin D3, K2. Again, you do these things, you don't even get cavities I'm right in the middle of that zone, that menopausal window, where supposedly my whole life's supposed to fall apart now. Well, it's not, because I'm understanding the changes and I'm adapting for them. So I take minerals and vitamins every single day to help feed my teeth.
Yeah, key. And you mentioned vitamin D3, K2, and along with magnesium, they all act to help pull calcium out of the bloodstream and into the bones. So we always have a certain amount of a pool of calcium in our blood, but we want a positive gradient moving that calcium into our bones, including our teeth, on a regular basis. Most people are deficient in vitamin D, magnesium, vitamin K2. Like, those are some of the biggest deficiencies. And we need all three of those on board in order to basically bring the calcium out of that bloodstream and into those bones to remineralize those bones properly. Yeah, so super, super key. Another big thing is that a lot of people just trust their kids to brush their teeth properly. Like, I have 4 kids. I have twin 10-year-old boys, an 8-year-old daughter and a 5-year-old daughter. And I always joke with my wife that I'm like a dental hygienist in the evening, because like I'm flossing them and I let them do it in the morning. They do their own in the morning, but like at night before they go to bed, I would say probably most nights, unless I'm out of town or something, I'm getting in there, I'm doing the flossing, I'm brushing, because I just don't trust them to be able to really hit all the spots.
Yep. I tell people all the time, you should be, we negotiate. So actually I have twins that are my first, also twin boys. Interesting. Yeah. But mine are old. Mine are 26. They both have children of their own. But I do this with my grandkiddos now, and even when I go to their house, I'm like, oh, guess what? Grandma gets to brush tonight. But no. I'm like, no, yes, we do. This is just how we do it, because you're correct. Children don't have the dexterity to floss and brush adequately until they have the dexterity to use a knife and fork adequately. That's kind of my rule of thumb, which if you think about it, it's like age like 8, 9, they simply don't have the dexterity until that point.
Yeah. I still do my 10-year-old boys. I'm sure at one point when they get about my height, they'll be like, I got this.
Dad, this is a little weird. Get out of my house.
Exactly. Yep. But, they haven't had cavities, right? So 0 cavities, dental checkups always look great. So, it's working.
Yep. Huge win.
Yep, absolutely. Yeah, another big thing are cavitations, getting teeth pulled out. And I've got a story about this as well. My wife, of course, she's my wife. So she eats healthy, lives a healthy lifestyle. She's in our sauna. Obviously it's stressful raising young kids and homeschooling, but outside of that, living a really healthy lifestyle. And she had these recurring sinus infections. And so we just couldn't figure out what was going on, had our house checked for mold, nothing there. We've got air purifiers all over. But she would get these sinus infections to the point where like they got so bad to where her eardrum burst. Oh, and then she had PTSD from that. So whenever she would start to feel it, she'd be like, I need antibiotics. And so, and here I am, a holistic doctor, and I'm like, oh my gosh.
I don't believe in antibiotics.
I know, right? It's like, come on, like every few months this would happen. And we were in Florida one year and like at the beach, and like 5 out of the 7 days she was in bed with this sinus infection, going to the, local clinic for it. And so I was like, we've got to figure this out. And so we actually had 3D x-rays done, and we had 2 holistic dentists. One of them is a real good friend. He actually has a similar story about mercury poisoning that got him into doing holistic dentistry, but he's not trained to look for specific cavitations. And he thought they looked great. We sent it to another local person. They thought her, they didn't think that there was anything going on with her wisdom teeth that were removed back when she was, 18 years old. And at this point she was 40. And so we finally sent them out to Dr. Stuart Nunnally, who's one of the experts. I'm sure you know him. Yep. Out in Marble Falls, Texas. And he said, there's definitely 3 infections. He's like, probably 4, but I won't know till I get in there. So we flew out. This was a few years ago, maybe 3 years ago. Flew out there, and he went in, did the surgery, and he found actually her upper right, which that was the side that would flare up even more. Her upper right wisdom tooth area, where that wisdom tooth was taken out, that infection was so bad it was budding up into her sinuses. So he spins the platelets. You probably do this. Yep. IV vitamin C, all this stuff, ozone in there, and disinfected it. And she hasn't had a sinus infection ever since. So
amazing. So Can we talk about what this even is, this thing we're talking about, this cavitation? Yeah, so it's really interesting. Every single tooth has a ligament around it. That's just how our teeth are held in our jawbones. The ligament is the connection between the tooth and the bone. It's kind of like the spongy part. When you chew, you have a little bit of give. So that ligament, if a tooth is removed, including a wisdom tooth, the ligament doesn't naturally just come out with it. I liken it to a little bit like the placenta and the baby. It doesn't, you have to intentionally remove this thing. Well, it's not intentionally removed on most wisdom teeth for good reason. I mean, the lower ones are down here by nerves and the upper ones are up here by sinuses. And, people don't really like to go poking around in those situations very much. But if that ligament's left behind, the body doesn't actually know that the tooth is gone for about 10 days. Because again, it's the connection between the tooth and the bone. And so in that 10 days time, the gum tissue grows over. I mean, if you think about it, you cut your finger, how long until the cut's healed? About 10 days, right? So the gum tissue grows down in and just encloses that dead ligament tissue in this jawbone area. The other thing that's the problem is when we are often taking out wisdom teeth, we're using anesthetic that has a high level of epinephrine. Why do we do that? Because we want you to stay numb longer, because we don't want you to hurt, right? So we want you to stay numb longer. Well, the more epinephrine that's used, the less blood flow comes to the area for a prolonged period of time. Well, blood equals bone. So if you don't have blood flow, you don't get bone growth. So now you have this dead zone that forms where that tooth was removed. It's not necessarily infected at that point, because when you had your wisdom teeth taken out, there probably weren't bugs in there at that time. But dead tissue always attracts bacteria. This is the root canal problem as well. Same problem with root canals. Dead tissue always attracts bacteria. So you get bacteria finding this tissue. If even not that, it always creates inflammation. So there's a higher level of something called rhontase, which is a cytokine. You, I'm sure, talk about this. I like to think of it like the flares that your body sends off, saying, problem, something's up over here. And that inflammation then affects in a cascade the rest of the body. So that if sounds most likely like your wives were very infected too, not just inflamed, but infected. So the gum grows over the top. After about 10 days, the bone goes, oh, I'm supposed to grow, but there's nowhere for me to grow. There's this dead ligament in here. There's the soft tissue, the gum tissue. I can't really do anything here. No blood flow, so nothing heals. These areas stay for decades. I had mine cleaned out when I was about probably 45, the same. One of my very favorite stories is a woman. She was in her early 30s, but had to move back home, was completely bedbound, had to quit her job and travel industry. Like, she was just devastated. And they tried every single thing possible to get her out of bed, to get her able to do what she wanted to do again. She came, took a cone beam CT scan, which is the crucial piece. That cone beam CT scan is a three-dimensional x-ray. This is what changed my world when I started taking these x-rays and saw hidden infections in wisdom tooth areas, infected root canal teeth that we couldn't see on traditional x-rays. I mean, so many things, sinus perforations that we had no clue about, crazy stuff. So we took the scan on her, found 4 wisdom tooth areas that hadn't healed correctly, and found 1 infected root canal tooth. Did all of it at once, put her to sleep, did exactly what you just described. We use ozone in the site, kills all the bugs anywhere, even deep into the bone. In fact, it was always so fascinating to me during surgery. We'd be working on someone cleaning out one of these cavitations and they weren't feeling anything, completely numb, not feeling a thing. And then all of a sudden we'd use the ozone and they'd go, oh, I'm feeling it. I'm like, what are you feeling? Back here, down my back, or right here in the front of my head. The ozone had followed the bacteria and it had gone to these other remote places that weren't numb. Like, I didn't numb their forehead, but the bugs were all the way up here and the ozone had tracked all the way up there. It was always so fascinating. So I learned to ask, where do you feel it? In my shoulder. What? The bacteria from your wisdom tooth had made it all the way to your shoulder. Crazy talk. So we kill the bugs. Then we use what's called PRF. So we spin your blood, centrifuge it out, pull out stem cells, growth factors, put it all in so that it can finally heal once and for all. So what do we do if you're going to need a tooth extracted or a wisdom tooth? If you have an old root canal tooth that we say, oh my gosh, this is infected, we got to get this out. How do you prevent the cavitation from happening in the future? We do the exact same steps. So at the tooth removal time, we make sure to remove the ligament, we ozone, kill all the bugs in sight and wherever else they are, and we fill that up with these stem cells called PRF so that we'll actually heal properly from day one. Because this woman that I'm talking about, we cleaned all that out. We did everything. The next morning, her mom woke up and heard something in the kitchen. She walked out and her daughter was up doing dishes. And she said, oh, what are you doing? You just had surgery. And she said, I feel better than I felt in a decade. The day after.
I've heard that from a lot of people, right?
Yep.
People with debilitating disorders. they get these things removed and they feel so much better.
Literally the day after. In fact, we do a survey of all of our cavitation patients 3 months after surgery, and we ask very specific questions. Why did you have this done? Would you do it again? Would you, have you had noticeable improvement? We have 88% of people saying, I found significant improvement already after 3 months. So this isn't just something little. It's actually something big. And this is the one that you said, just when you said earlier, if you have done everything right and your patient's doing everything right, they're doing the nutrition, they're doing like all the things, and yet they're still stuck. Go get a cone beam CT scan.
You have to look at this. Yeah.
It's going to be in your mouth. I can almost tell you 100% it's in your mouth.
Here's the issue though, that the cone beam scan, not all, just because somebody is a holistic dentist, that means usually that they're not using mercury, fluoride, things like, which is good. That's a good thing. However, it doesn't mean they're trained on how to read these cone beam x-rays.
Yes. So you need to specifically ask that. Are you trained? And there also are radiology services the dentists can send the scans to. We do double. We actually send our scans to a radiologist because I'm not trained to look for pathology. Like if you have a tumor somewhere up in your brain, or your sinus, I'm not trained to see that. So we send it to a radiologist to look for pathology. We also are very trained internally. All of our doctors are very trained internally to read these scans. So this is a question you need to ask on the phone. Are you trained to be able to identify cavitations and failed root canals on a cone beam CT scan, and look for airway? This is, we see so much information about why people aren't sleeping at night. A lot of this is structural, and we can see so many answers on that scan too about that.
Yeah, that's really key. And so you mentioned airway. How does your mouth impact the way that you're breathing?
So it's literally just the structure of it. So there's a tube that goes from your nose and your mouth down to your lungs. And if you think about the driveway of that air, where does it have to go down to get to those lungs? It's going to have to pass the back of the mouth. Well, the mouth is a limited structure, right? Everything inside of it has to fit inside of our cheeks and our lips. So our teeth have to fit inside of there, our tongues, all of the tissue, the palate, the tonsils, all of that actually has to fit inside of this space. Well, unfortunately, today, many of us didn't grow as large as we should have. This is why so many kids end up with braces, crooked teeth, why everybody's getting their wisdom teeth out. If you look at skulls 300 years ago, everybody had all of their teeth, including their wisdom teeth. They were all straight. Why do they not fit anymore? The first bone affected by malnutrition is actually the top jaw. I learned this because we adopted my son at 2.5. He had an incredibly small mouth and he was very malnourished. So I did a lot of research at the time and went, oh my gosh, the first bone affected by malnutrition is the top jaw. So we unfortunately are malnourished in our world today. I know you've probably heard it said we're the most overfed, undernourished, society in the history of time because our food just doesn't have the nutrients it used to. So we end up with small mouths. Well, if we have a small mouth, it's like a garage. You have a big old truck and you got a tiny little garage. It's going to hang out into the driveway no matter what you do. Like the garage is not getting any bigger. So it hangs out into the driveway, which is where the air passes. You lay down and it gets even worse, right? All that tissue falls backward. And when you get into deep sleep, your muscles paralyze. So even if during the rest of the time you can kind of brace your muscles all forward, your tongue, everything forward, when you get into deep sleep, it all falls backward. And if your body can't actually let air pass, if there's no room anymore for air to get past, it will do a couple of things. You're going to squeeze your teeth because it tightens up all the muscles again. Lets air pass. As soon as you squeeze your teeth, you're out of deep sleep. So you've just aroused immediately. So you're going to toss and turn. You're going to roll over. As soon as you move a muscle, you're out of deep sleep. It's like, does this make sense? So you're constantly arousing. As soon as you get into that deep restorative place, you're back up again because you can't be there and breathe at the same time. Your body won't let you die. It won't let you suffocate at nighttime. It will just keep you slightly awake. So either you're awake and you go, why can I not sleep? Why am I like waking up and I'm super panicked and all these things? Or why can I not go to sleep at night? Or why do I wake up feeling like trash? I swear I was in bed for 8 hours. Why do I feel like I slept 1? Because you did. You only slept 1. So what do? We can actually make the garage bigger. That's the answer. It's not just like hold the part of the garage forward. That's what a lot of people do. They just put your bottom jaw forward. It does make this open, but guess what it does? Research shows after 4 years, it irreparably damages your jaw joint. Now we have people coming in that their back teeth don't touch anymore at all when they chew anytime because they've been holding their jaw forward with air or with an appliance to get more air. A CPAP fixes nothing. This is like just putting more water down a plugged drain. This is a plugged drain right here. We're just going to put more water in it. That's going to fix it? No, we got to unplug the drain. So a CPAP does nothing to actually fix the problem. What we need to do is make the garage bigger. We have to expand teeth out, tip teeth out, everything we can do. Get the tongue forward and out of the airway. We retrain the tongue with something called myofunctional therapy. All of this to get it out of the driveway so that when you sleep, you can get air and sleep at the same time. And we have seen so many life-changing transformations just giving people the air they need. In fact, life expectancy decreases by 20% if you aren't getting the air you need at night. So if you were going to live to 80, you're going to now live to 60 because of this. Well, I'm not willing to lose 20% of my life expectancy because of something that we can fix. We can make the garage bigger. We can expand things out. We can make enough room for your tongue. We can get you sleeping again.
Yeah, sleep apnea is a really serious issue. So that's another one of those types of things. If you're waking up just absolutely exhausted, you feel like you're waking up, you're restless, in your sleep, you definitely want to get checked for sleep apnea. Now, with this myofascial therapy, how long does that take to correct? Like
6
What
months,
is that process?
but it's not
6
like
months?
it's intensive. You're going to do a couple of exercises like put your tongue to the roof of your mouth 10 times today, like it's not like it's intense exercise, but it's retraining muscle memory, which muscles have a memory and they're going to go back to doing what they did unless you retrain them how to do what they need to do. Sometimes a tongue tie needs to be clipped. Oftentimes that small upper jaw is because the tongue couldn't actually get up there during nursing when the baby was brand new and didn't actually create a wide enough palate. This is very developmental. And so children, you have kiddos.
Yeah.
This is what we're watching for in kids, and we're doing all sorts of what we call interceptive orthodontics. So we're trying to intercept these growth and development issues. They'll show up in kids as dark circles under their eyes, ADHD symptoms because they aren't getting enough air, so they can't sleep well, mouth breathing, hanging their mouth open at night, snoring. A child should never snore. A child should never mouth breathe. All of these things, if you think about mouth breathing, what you're doing is all night long, the mouth is coming down, which is actually this. Remember we talked about this is the outside of the garage. This outside is now pushing on the bones, and those bones are going to grow long and narrow. The nose is going to go long and narrow, and they're not going to be able to breathe for the rest of their lives out of this. So we have to intercept this. Bedwetting is actually another sign of pediatric airway problems. So these are all things we identify early on, and we work to expand this garage while the growth is still happening. That's the magic time. We can fix it in an adult as well. It's just a lot harder. It's a lot easier to direct the growth while the growth is still happening.
Yeah, that makes sense. I was a mouth breather, and then about 10 years ago, I started doing mouth taping and just took tape, put it over my mouth. And I mean, within a month, it was like I retrained, and I was just trying to be more intentional throughout the day to be a nasal breather. And that's something I continually, I don't mouth tape anymore. I don't feel like I need to, but I do just intentionally take time to just kind of focus my breathing and making sure that I'm breathing through my nose on a regular basis.
And some people can't because of their structural physiology. So that's when we have to change things so that they can.
Especially if they're lying on their back or their side with that sleep apnea.
Yep.
Yeah, really, really key stuff. And so you're still seeing patients out there, is that right? How do people get a hold of you? Obviously, you've got a lot of great products on your website, which is livingwellwithdrmichelle.com. Great website, tons of great information, really great dental products, guys. You'll definitely have to check that out, livingwellwithdrmichelle.com. And you have a dental team as well. How do people contact? Is it the same website to contact you guys?
Nope. The dental website is called Total Care Dental. So Total Care Dental, we're in Utah, but like I said, we actually have patients travel from all over the place to see us. We have a full multi-specialty team on site because I believe we should be able to take care of everything when you come and see us. So we don't send you out all around. So we want to take care of you. Yep. And that's what we do there. Living Well with Dr. Michelle. Please go on. If you have questions, briefly touched on a lot of these topics. I release a YouTube video or two every single week. Just go find free content about any of these things. My mission is to help you understand these things in a simple, applicable way, so you can take it and go, that's what I need to do now. So go check it out if any of these things you have more questions about.
Yeah, that's great. And like my wife and I, we flew out to Marble Falls, Texas. We flew out to Austin. And so people can fly into the Salt Lake City. You're not far from the Salt Lake City airport, right? Which, I'm from Atlanta. Atlanta's like a craziest airport. We flew into Salt Lake City and it was like, wow, this is quiet.
Isn't it beautiful too? It has like these huge tall ceilings overlooking the mountains. Like, it's a great airport.
Oh, for sure. For sure. So you could fly in there, and especially with these cavitations, because that's what I found is that there's really not a lot of people that have this expertise and a lot of experience with how to treat these cavitations. There are a lot of holistic dentists out there, fortunately, and that's growing. But again, most of them are mercury free, fluoride free, which again, very good thing, positive advancements. But they just don't know how to handle these cavitations. And many of them are still giving root canals and things like that. I know for you, it was a journey, right? You had to learn.
It was. Yep. I had to draw a line in the sand and say, I'm never doing that again. But yeah, we have a full-time surgeon on staff that takes care of it. And I used to do all the surgery myself, and I actually handed over those reins to him because I believe surgery should be done by a surgeon. And it is now in our office.
Good for you. Excellent. Well, Dr. Michelle, this has been a great interview. I have to have you back in the future, but I know people will get a lot of great content out of here. I mean, if you walked away with the idea just that there are different types of cavities, and even if you got a cavity diagnosis, that does not mean that you need some sort of filling in your mouth, and that you can use hydroxyapatite. You can use the remineralizing, hard to say that word sometimes, remineralizing tooth powder, and then mineralize your body. Eat a lot of high trace mineral rich foods like sea vegetable, wild caught fish. If you do dairy, grass-fed raw milk, grass-fed beef, you've got all different, organic fruits and vegetables, colorful fruits and vegetables, all rich in minerals. So make sure you're eating a lot of high quality minerals, and just a nutrient-dense diet like I talk about all the time on this podcast, and start using the remineralized tooth powder at home on a regular basis with the red light toothbrush. It actually takes it to the next level. I don't know if you've practiced with that. Have you had any experience with red light toothbrush?
I've not. Now I'm going to have to go try.
You got to check it out. Yeah. You got to check it out because there is actually really good research on red light. So, our ancestors would have been exposed to red light on their skin a lot. Like they would have gotten a lot of red light from the sun on their skin, but you would get very little on your gum lining naturally from nature. So the gum lining, those cells are very photoreceptive, meaning like it goes a long way. A little bit goes a long way. Like 30 seconds in there goes a long way. And there's there's actual research on this for improving nitric oxide, so better blood flow, which is going to get more of the minerals up, reduces inflammation. So, it takes it to the next level. So there you go. It'd be a good partner for you.
Report to us. The combination together.
That's right. Combo, synergized.
Yep.
All right. Well, great. Dr. Michelle, again, great interview here. Guys, check out livingwellwithdrmichelle.com for all of her great products there. And everybody, be blessed.